Hello, I'm Cristina Guirao, occupational therapist and physiotherapist from the stroke unit at Vall d'Hebron Hospital. I'm going to talk about the most common alterations that a person can present after having had a stroke, and we will give you some tips to keep in mind. In this video, we will see alterations in communication, cognitive and emotional behavioral alterations. I will start with alterations in communication, and more specifically, we will talk about aphasia, which is difficulty in expressing and or understanding language, oral or written. An example would be anomia, which occurs when the person doesn't remember the name of the object. That is, instead of saying comb, they say that thing that is used to comb your hair. Also, involuntary repetitions of one or more words may appear out of context, which would be what we call verbal stereotypes, such as house, house, or unintelligible expressions. Some tips to keep in mind are: encourage the person to speak, use short phrases with simple answers and wait for them to answer. In the event that the person is stuck, you can help them with the first letter or syllable of the word that they are trying to say. It's never advisable to talk to them as if they were a child, because they are an adult, and don't shout because they don't have a hearing problem. Another alteration that a person may present after a stroke are cognitive alterations, of which the most frequent are memory problems, especially difficulties in retaining new information, problems orienting oneself in time and space, and slowing down and rigidity of thinking, and difficulty in problem solving, alteration in the ability to imagine. In this case, some tips to keep in mind for the family or caregiver are: give simple and concrete information, carry out cognitive stimulation activities that pose a challenge for the person but avoid frustration. It's important to never assume that the person is lying. It may be that they don't remember or their perception of reality is different from ours. Finally, I'm going to talk about emotional disorders, which can appear as depressive symptoms, compulsive crying, moments of euphoria and dismotivation. Also, changes in behavior can appear, such as loss of interest, little flexibility to change, loss of initiative, slowness, irritability, among others. As advice for the family or caregiver, it's important to actively listen, involve them in meaningful activities, read calmly to any situation where the person becomes upset. And finally, it's advisable not to criticize or take their behavior personally. Remember that it is due to neurological damage. For more information, you can contact the stroke unit through NoraChat.